Hey guys, good morning. I'm Jenna. I'm a hygienist here at Micros Dental Clinic, and I wanted to invite you into a day in the life. So let's go into work. This is where I work. That was the worst handshake. Morning! Hi! Thank you so much! So I've got my first patient in a few minutes, so I'm just gonna prepare my room and lay things out, take a look at the schedule. So since we are in a pandemic, we have to add a few things into our everyday PPE. So we have disposable gowns for each patient. I have a shield. I still use my loops, obviously a mask, and I'll even grab some gloves out. Oh, can't forget my favorite cute little hat. Doesn't look very good when I have my bun in, but it's okay, it works. To make a day successful, you have to prepare. So I will do as much as I can before patients come. But then we have really awesome nurses that I absolutely adore and love, that they are so helpful with cleaning my room and getting to know them. Let's go grab a cup of coffee. Good morning.
Good morning.
Hi. I will just have my regular. I think, would you have caramel today?
Yes.
Awesome. So I'll do a caramel cappuccino. Do I want it hot or cold? Do you have ice?
Yes.
Have a great day. I'll see you later.
Okay.
Thanks. Of who I'm seeing today, so I'll look at x-rays, I'll look up their last clinical notes, see if they're seeing the dentist today, just so I can be as prepared as possible. So always like preparation is key. All right, time to, guess you don't want to talk when this is going. And what type of toothbrush do you use?
Sonic hair.
Oh, nice. Is it a Diamond Clean Smart or just a regular Diamond Clean?
I don't know, my wife got it.
Oh, what an awesome wife. All right, now I'm gonna hand you this mirror. We're gonna look together. Let me hold that. Yeah, fix the hair, that's good. Okay. All right, so we're gonna see a couple different colors on the teeth. Go ahead and open. Pearly whites. Would you looky there?
Wow, amazing.
Oh, sorry. So just a little bit of tartar in between there. Other than that, what kind of toothpaste do you use?
Sensodyne.
Oh, good answer. All right, so I'll see you in 6 months.
Awesome, thank you so much.
My pleasure. We'll just get you checked out here with one of our lovely receptionists. We'll go right here to Mariah.
Oh, you go Mariah.
Awesome, so Mariah, if you can book them in for 6 months, and then we'll see you for a checkup then. Awesome,
Perfect.
Nice to see
Thanks.
you, Josiah. Good morning, it's Jenna. Hi, I'm doing well, how are you? I saw that you're free and I actually will come up and talk to you. Would you like me to grab you a coffee? Okay, what kind of coffee would you like? What can I get you? A lungo? Wonderful. Awesome, I'll take it. Thank you much. Good morning. Here's your coffee, just the way you like it.
Okay,
What do coworkers do for each other? You're welcome. See you later.
See you later. Thank you so much.
Have a great day. You're welcome. Thank you. Appreciate you. All right, let's go say hi. Morning. I'm doing well, and yourself? Wonderful. That was the worst handshake. No, focus on the elbow. I'm gonna go eat some lunch and just call me if my patient comes early. See ya. Yep. Hello. Oh, man. Oh, right in the corner. Sorry, I didn't mean to bump the table. Oh. All right, bye. I'm gonna go get my teeth cleaned. All right, see ya. I brought my own powder. I'm a hygienist, but who cleans my teeth? Luckily, I have a hygienist. And so you're my hygienist. Good stuff. Thank you so much, Dulene. Appreciate that. Awesome. Bye, Dulene. I'll see you soon. All right. So we are gonna barrier the room. And now we'll take this to sterilization. There you go. All right, guys, it's been real. Thanks for hanging with me today, but now it's time to do some clinical notes. See you next time.